The number of worldwide COVID-19 cases surpassed 300 million on Friday, with over 5.4 million deaths. More than 59 million of those infections have been reported here in the U.S., and nearly 836,000 Americans have died since the start of the pandemic. The spike in new infections fueled by the Omicron variant is showing no signs of slowing down. The CDC has also been under fire for what many consider to be confusing advice on how to handle the surge. Manuel Bojorquez has more from Miami.
Today, after much criticism, the CDC tried to clarify its guidance for those who test positive for COVID but no longer have symptoms, saying if they want to use a rapid test to determine whether to leave isolation after 5 days, it would be the best approach.
If it's positive, stay home, and if it's negative, please continue to wear your mask, because that does not mean you're no longer infectious.
As the CDC encourages people to get boosted when they're eligible, the FDA shortened the time between a second Moderna shot and a booster to 5 months, like it had for Pfizer's. Moderna's CEO said a fourth dose may be needed in the fall, but West Virginia is asking the CDC for a second round of booster shots now. This comes as Citigroup announced unvaccinated workers will be fired at the end of the month, becoming the first major Wall Street bank to enforce a vaccine mandate. Meanwhile, Omicron surge is pushing hospitalizations up in 46 states, rising 40% nationwide from the previous week's average. And the rate of hospitalization for children under 5 who are not yet eligible for vaccination is the highest it's been since the pandemic began, doubling since last month. Florida today broke its single-day record for new cases with nearly 77,000. The state is being criticized for new guidelines discouraging testing for healthy individuals who have been exposed to COVID but show no symptoms, though scientists warn they can still spread it.
You don't want to be responsible for putting someone you love in the hospital.
And state officials are under fire for letting about 1 million test kits expire in a warehouse at the end of last month, when holiday demand for testing was high.
We tried to give them out prior to that, but there was not a demand for it.
There's a disturbing figure out tonight. One study says up to 80% of Floridians will have caught COVID-19 by the time this Omicron wave is over. To ease demand at testing sites like this one, the White House and U.S. Postal Service are said to be finalizing plans to ship testing kits to U.S. households as early as next week. Lana?
Manny, thank you. Dr. Shad Marvasti joins me now. He's the Director of Public Health Prevention and Health Promotion at the University of Arizona College of Medicine in Phoenix, as well as an Associate Professor of Family, Community, and Preventative Medicine. Dr. Marvasti, the last time that I had you on the show, just a little bit over 3 weeks ago, Delta was still the dominant variant in the U.S. And according to the CDC, the Omicron variant now accounts for 95% of COVID cases here. Are you surprised by how quickly this new strain has spread nationwide, and might this have been handled better?
No, Lana, I'm not surprised. We know that the doubling time of Omicron is every 2 to 3 days as compared to every 2 weeks for Delta, so we expected to be here. I think it could have been handled better in the sense that we could have had better public health mitigation measures in place, both in our state here in Arizona as well as throughout the entire country. Really could have benefited, and we can still benefit from a national mask mandate, as well as vaccine requirements for engaging in high-risk indoor activities like dining, going to bars, or sporting events, anything that's indoors in public, to really help mitigate the spread, because it's spreading so quickly that it's overwhelming our healthcare system. And that's really a big issue. In fact, as some of the stats were reported, hospitalizations are now actually as high as they have been during the Delta surge peak. And we're seeing hospitalization record numbers for kids under the age of 5 who can't get vaccinated. So for anyone who says that Omicron is mild, I challenge you, who are you talking about? If you're talking about someone who's vaccinated and boosted, perhaps it would be the case that it's mild and relatively so, and I'm seeing that clinically. But for someone who's unvaccinated, including unvaccinated children under the age of 5, this is definitely not a mild variant.
I'm glad you clarified that, because there are a lot of people who have been talking about how this is much more mild, that it's more transmissible but more mild. But it's important to make that distinction between an unvaccinated patient and a vaccinated patient. I also want to get your take, Dr. Marvasti, on testing, because we're hearing a lot of confusion, really, about testing, which test is better for detecting the virus. Tell us, why do PCR and antigen tests sometimes produce different results? Is one more likely to produce a false positive or negative? What are the key things that people who are now really taking more tests and in many cases taking at-home tests who haven't done that before, what do they need to know?
Well, the at-home tests are the rapid tests, which are antigen tests. So if it's a test that you don't have to send to a lab, it's an antigen test, and it's basically testing the protein of the virus. And so you can get many false negatives. If it's positive, then you likely have it, especially if you have symptoms. So it's perfect for a screening test if it's positive. But if it's negative, because of the high false negative rate of these rapid at-home tests, you really need to get a PCR test to know for sure. And given the high level of community spread that we have right now, if you have any symptoms at all and you have a home test that's negative, I would still assume that you have COVID until proven otherwise by a PCR test. Act accordingly and let your contacts know, and also protect your family.
Given what you're saying about this high level of false negatives with the antigen tests, which are the ones that we're taking at home, and the latest guidance from the CDC that after testing positive for COVID, you need to stay at home for at least 5 days, and then you take that rapid antigen test. Explain to us why you think the CDC has made that guidance, and how confident people should feel about going out in public and exposing people that they love potentially to the virus with that possibility of a false negative.
I think it's a compromise that this CDC has struck here between the need to have healthcare workers and essential workers in the economy, and the data that shows that the amount of infectivity, or the extent to which you can spread it and how infectious you are, really goes down precipitously after day 5. That's not universal. It's definitely not true if you're symptomatic, but if your symptoms have improved, or if you're asymptomatic, but you just had a positive test, then you probably are going to get a negative test, and it probably is going to be a true negative even if it's at home. But it's still hedging. It's not 100%. So if you really care about who you're around, I would say that even at the 5-day mark and beyond, and I think this is part of the guidance, is to wear a mask, but I would have also added wear an N95 mask. And that's another issue too. When we talk about wearing masks, it really doesn't suffice with the new variants that we have. Ever since Delta, honestly, we can't really get away with wearing surgical masks, cloth masks. You really need to wear KN95 or better. And really at this point, I would say N95 if you're going to spend any considerable amount of time indoors, in public, anywhere, to protect other people as well as yourself. In the case of someone after that 5-day period, they they want to go back into the world, I would definitely wear an N95 and keep your distance as much as possible.
The important point, all masks are not created the same. The 95 masks are tested to filter about 95% of particles, as opposed to the cloth masks and the surgical masks, which are about 50%, and not at all effective if you're wearing it down here. Speaking, though, about tests, they're hard to come by. So what's your recommendation if a person can't easily get tested?
I would say if you can't easily get tested, just take all the precautions and take care of yourself as if you have COVID at this time, right? That's going to change if hopefully 4 to 6 weeks from now, the numbers come down dramatically and we burn out of this Omicron surge. At that point, it's a different matter. And at that point, you probably will be able to get a test. But at this point, honestly, it's about taking care of yourself and also taking care of all the people that you're in contact with. So if you're sick at all and you can't get a test, I would let people that you've been in contact with know. I would consider letting your employer know and potentially staying home, taking all the precautions you can to protect yourself and others. And of course, if you start getting really bad symptoms and you feel sicker, that's the point where you need to go into the urgent care emergency room. Here, we're already getting recommendations from emergency medicine physicians not to just come into the hospital for a test because we're so overwhelmed, we don't have time and ability to actually give you that test. So you definitely shouldn't go to urgent care emergency room right now just to get a test.
Dr. Marvasti, before I let you go, I have to ask you about something that's a bit odd. There's a new study that suggests that COVID vaccines may cause women's periods to be late. Is this something to be concerned about? What more can you tell us about this study?
I wouldn't be concerned. The study showed that there's just some change in terms of the timing of the menstrual cycle. And it's a real slight irregularity that is not permanent. It actually just lasts for a few weeks and then it goes away and it completely resolves. The alternative, okay, for a woman considering the vaccine, getting a COVID infection definitely increases your risk of permanent infertility and permanent problems with your menstrual cycle. This is something that is temporary and fleeting as your body adjusts to and builds immunity from a vaccine versus getting COVID puts you at real risk of being infertile and having permanent problems with your period. So I think when you weigh the risks and the benefits, it's still a slam dunk in terms of getting vaccinated.
All right. Dr. Shad Marvasti, thank you for joining in. Thank you for all that you do.